How the mirrors breaking into pieces on the ground. Don't you know you gotta let go, turn off the cell phone. You don't need to conversate anymore. Take control, you gotta let go, turn off your cell phone. You are your brother's helper, we are each other's shelter. We can move the world together, give the world a little shake. We are the earthquake. We can change the world forever, give it just a little shake. We are the earthquake. Everybody has to stay. We are the earthquake. Brace yourself. Can you feel the thunder rolling underground? Face yourself. Is it any wonder that the mountains are all tumbling down? Take a stand. You gotta reach out, turn off your cell phone. You don't need the status quo anymore. Take my hand, reach out, I'll never let go. We are our brother's helper, we are each other's shelter. We can move the world together, give the world a little shake. We are the earthquake. We can change the world forever, give it just a little shake. We are the earthquake. Everybody has to stay. We are the earthquake.
Assalamualaikum warahmatullahi wabarakatuh and good morning. First of all, before we begin our ceremony today, let us Muslim recite Al-Fatihah. Amin amin ya rabbal alamin. So today, good morning everyone and hello, assalamualaikum. Hello speakers, how are you?
I'm good, thank you.
So before we start, I would like to introduce myself. Today I am your moderator for RADSA's event entitled Radiographers on the Frontline of Healthcare Delivery Beyond COVID-19 Era. I am Zulfa binti Mohamed. I am the first year student of Bachelor of Medical Imaging in KPGUC from cohort 14A. I would like to welcome everyone, our audience today. Thank you for spending your morning with us. Maybe you have no classes today. It's good. Terima kasih kerana memanfaatkan masa anda untuk menonton kami pada hari ini. Sebelum bermula juga, saya ingin memberitahu kepada semua audiens kita pada hari ini bahawa RADSA, iaitu RADSA Radiography Association for Students of KPJUC akan mengadakan video and photography competition that started tomorrow. Ianya terbuka kepada semua orang. Terima kasih kepada speakers kerana anda meluangkan masa anda bersama kami pada hari ini. Jutaan terima kasih diucapkan kepada Encik Esnu dan Madam Mary. Encik Esnu berada di Malaysia ataupun di Singapura?
Assalamualaikum semua. Saya sekarang masih berada di Singapura. Sudah hampir 2 tahun tidak dapat pulang ke Malaysia.
Oh, because of COVID?
Yes, because of the COVID.
Oh, okay. Madam Mary, how are you? How's the Deepavali?
I'm fine. I'm back to work today.
Is your Deepavali joyful?
Yeah, it was joyful, but it was sad. I had to send my daughter to Polytechnic Jelly, Kelantan.
Oh, it's okay. Maybe every day be joyful for her. How's the jam?
Yeah.
How do you get back to KL from Kelantan? Is the traffic alright?
Very hectic. It was a very hectic traveling. Yeah, with the roads. Yeah. Yeah. We are waiting for the highway to be ready lah.
Okay. So I would like to inform our viewers today that our speakers bukan calang-calang punya orang, and I would like to tell them their background. And to be honest, sebelum I start talk ni, I read their background, and to be honest, I am super impressive. Like it is like a very magnificent CV, you know. So we start with Mr. Esnu. Mr. Esnu has a work experience of 15 years in the healthcare industry. Currently, he is working with Fujifilm Asia Pacific, Singapore since 2018 as Asia Pacific Clinical Marketing Manager. So I tell you, Mr. Esnu, before this, I just know Fujifilm as film company. That's from where Instack from, where my film from. So I thought macam, oh, medical imaging because it's imaging. So we got to go through it.
Yes, most of the people still think about it, but I
Yes.
think Fujifilm has shifted a lot of advancement in technology for the past 20 years that we are moving into digital and everything. Later you will see what we have done for the radiography world.
Oh, okay. I see. Cool. So while for Madam Mary, so Madam Mary has an experience of working for 26 years. Now she is the head of radiographers in Hospital Tunku Azizah, Kuala Lumpur. Also since 2018, her first post was in Hospital Seremban Negeri Sembilan. So Madam Mary, when when I read your work experience, 26 years, I feel like you like an army, you know, an army marching toward her dreams for 26 years. It's very impressive. It's like you are so patient in climbing your way up. I was so inspired by you. Very cool. So, okay. So actually today our speakers have their own slides and they will present them to us. So I would like to start with Madam Mary to present her slides. Please, Madam Mary.
Thank you for the kind introduction, Miss Zulaika, moderator for today. And
It's
thank you for the
Zulfa,
organizing
Madam.
committee for inviting me to this event, a special event in conjunction with World Radiography Day. Okay, maybe can go to my slide. Okay, so I wish to convey Happy World Radiography Day and International Day of Radiology 2021 to all the audience today. Okay, so maybe we'll be wondering why Happy World Radiography, why International Day of Radiology. So in the beginning, it was just World Radiography Day for the radiographers actually. So the theme for this year is the role of radiographer in a pandemic. And International Day of Radiology has a fraternity of radiology. We celebrate International Day of Radiology. So for International Day of Radiology, the theme is Interventional Radiology, active care for the patient. Okay. Okay. So as a very good morning to all, and also happy belated Deepavali to those celebrating. Hope all of you had a good holiday after the interstate traveling and festival season. So again, but please be vigilant and careful. The pandemic war is still on. So stay safe and healthy. So today I'll be presenting the topic radiographers on the front line of healthcare delivery beyond COVID era. From the perspective of a clinical and management radiographer, because that is my field. Okay. So as we know, coronavirus disease 2019 pandemic has placed significant challenges on the healthcare system. And we radiographers are not left alone with the challenges. This has been primarily, we had to dramatically reduce inpatient and outpatient services for other diseases and implement infection prevention and control measures when we had to face this era. So academic and hospital-based, private and public, inpatient and outpatient facilities, as well as diagnostic and therapeutic services has been dramatically impacted by this pandemic. So as we know, radiographers, when we say radiographers in Malaysia, we consist of radiographers from diagnostic or medical imaging, nuclear medicine, and also radiotherapy. So, sorry. Okay. Sorry for the interruption. There was just technical error there. Okay, so across Malaysia, we have these many types of machines that really help us in our profession. The topmost are the diagnostic imaging equipments, and in the middle, you see the nuclear medicine machines, which is the gamma camera, the PET-CT and SPECT-CT. And in under radiotherapy, we have linear and brachytherapy. Okay, so there's a vast variety of modalities that we use. Okay, I always like to share this slide of what are the 8 key areas integrated or related into the practice of radiographers. So when we say radiographers, our practice is involved with patient care, the use of technology, optimization of dose in terms of radiation, clinical responsibility, administrative aspects, quality assurance, education, and research. But overall, when we look at it, we can divide it into 3 sections, that is clinical and patient care, administrative and quality improvement, and also research and education. Okay, as we look at our topic today, so we radiographers are key patient-facing healthcare professionals involved in many aspects of patient care. So the working patterns and professional practice of the radiography force has to be altered during the COVID pandemic. So let's look at the impact of COVID-19. Okay. So COVID-19, okay, COVID-19 impact. Are you all able to see my slide properly, or is it blocked or anything like that? Hello? Is my slide okay, or?
I've seen only half of it, so the other half still the front page.
Why?
It's like macam
Now?
dia macam overlap,
getting better.
madam.
Now? Okay.
Okay, cool, good.
Okay, I'm sorry for that. You all should have told me before. Okay, right. Okay. So the impact of COVID-19 radiology staff, we had 3 key challenges in the administration part related to COVID. So we had increased demand for diagnostic imaging, especially for chest X-ray, mobile, and also CT thorax. At the same time, we had decreased demand for other diagnostic imaging. So all this had an impact on radiology staff. The second thing that key challenges was the staff uncertainty and morale. I'll be going one by one each one. Okay. And then number 3, planning for the unknown, because the situation is something that we were not aware of or we were not trained of. So it's something unknown. So we had to keep on planning for the unknown. So when I say increased demand for diagnostic imaging, chest X-ray, because the initial acute phase of pandemic, chest imaging was emerged as one of the key diagnostic and monitoring tool for patients of COVID. Consequently, only they suggested CT thorax. So the initial part, we had more mobile chest X-ray. Then later on, we had more CT thorax. So then later phases, other elective and non-urgent diagnostic and screening services were paused. They were not stopped, but paused in some settings because cases were increasing drastically. And we need to do chest X-ray for everyone. Every single COVID patient, we had to do chest X-ray. So in that case, we had staff burnout. Okay, staff burnout, where we had to divide the staff into teams and roster them accordingly so that they can rest mentally and physically. So though their thoughts are always on their family members' health and safety, always in their mind, that was always in their mind. So we needed to help them out and refer them for counseling and so on. The other thing we had to do was staff redeployment, because with some were non-COVID hospitals and some were COVID hospitals. So we had to redeploy radiographers from non-COVID hospitals to COVID hospital to help out with the drastic workload. And the third thing that we did was recruitment of contract of service staff. Okay, we recruited around 600 over contract of service staff to help out in the KKM facilities. So as in for the staff uncertainty and morale, There was always an assumption in hospital that frontline workers were doctors and nurses. So always radiographers used to feel frustrated. Why is it we are not acknowledged as frontliners? So that also affects them in a way. If after all the hard work they do, they are not being appreciated. So we had to maintain a level of trust between staff, leadership, and organization. We had to communicate and reassure staff. We also had to make sure there is adequate amount of PPE because safety is important. We have to take care of our staff. So we had to make sure PPE is enough. When PPE is not enough, it's a lot of frustration within the radiographers. No, we had to do the work, but PPE not enough, and so on. And the other thing is to advocate for the staff, meaning we had to let the public know that radiographers are also the frontliners through more social media. We use Facebook and all that to advocate about radiographers. And also we had this program under RTM, Bicara Diary Rawatan, which I did speak for 5 minutes lah about radiographers. And also we had Bulan Promosi Profession Sains Kesihatan Bersekutu, where we shared many flyers and infolets on radiography. So this is how we advocated. Okay. So planning for the unknown, as I said, planning for the unknown, it's an unknown situation. Okay. I remember being called to send radiographers to Sabah one morning, and then suddenly they said they want the name by noon, and then by 3 p.m. you are already, you have to attend a virtual meeting to make sure you have enough people, and you have to transport them to Sabah and all that. All these things we are not planned. We have to plan it ad hoc, and we have to make it happen. So, and also staying safe in an infectious disease environment was new to us, something new to us, something all of us are not used to it. So putting on PPE properly was a new skill we had to learn. We had to learn how to keep a safe barrier between us and patients, between staff members, while still providing care. So what I meant is we needed to, we need to, for intensive planning, we had to have intensive planning. We had to look at the imaging room. Sometimes it is not the existing imaging room that we use. We modify a room and make it an imaging room. In there, we have to find out about the air exchanges there. And we have to we have to plan and implement all our plans. It's not just planning, we have to implement straight away. And we have to train and train and train the staffs, okay? And protocols keep changing from time to time because we are dealing with something unknown, okay? So, and also we had to work closely with healthcare organizations and associations and always prepare for unexpected scenarios. As in for therapy radiographers, this is something that I read because I'm not a therapy radiographer. The major changes was in increase the use of radiotherapy as first treatment for cancer, because in response to reduction in surgery, operations were less. So radiotherapy had to work hard to make sure cancer patients don't deteriorate so fast, you see. So they had to have more treatment for cancer. They had to change their schedules. Then they also had to alter their protocols and so on. So like, for example, breast cancer was brought forward. Breast cancer patients were brought forward for examinations and so on. Okay. The next is nuclear medicine. I found out that they also had reduction in PET-CT and conventional diagnostic nuclear medicine services, almost about 15 to 60%. So therapeutics, especially for benign thyroid disorder ratio, also were decreased. So there also was reduced staff availability due to infection, because when you look at nuclear medicine, the human resource is very low. In terms of radiographers, and when one get infected and all that, and then they were also been transferred to other departments, to radiology departments to help out with the heavy workload. Okay, so lessons learned from COVID. First of all, training. How we train is something that we need to learn, that we need to train people. Okay, actually in the beginning there was none or limited training about COVID infection control, prevention, patient management. And there exists, so because of limited training, there was lack of understanding about appropriate infection control procedures during the pandemic. So there were poor communication protocols, there were poor dissemination to the staffs and all that. So these are the things that we learned that we need to improve. Okay, lesson 2 in terms of infrastructure, technology and clinical workflow. So there was increase in imaging workload volume. There were changes to operations and procedures, staff redeployments and extended shift hours. Infrastructure, technical resource needs also was there because many of the places they didn't have enough mobile radiography, they didn't have enough digital mobile radiography. In fact, Fujifilm helped us a lot actually with this. Yeah, I think Mr. Esnu will be talking about that. So I think that is one of the Fujifilm machine that we got in PKRC, Saradang. Okay. So, and then the lesson 3 is about the workforce mental health and well-being, because staffs, radiographers get burnout symptoms. They have emotional and psychological dilemma in terms of thinking about their family, in terms of infecting their family and all that, and then anxiety in terms of fear also in infecting their family members, patients and other co-workers, particularly. Okay, and then they have their own work related stress. So, and about redeployment also, it's anxiety there. Redeployment, they have to get used to the new working environments. They also need to work with new technology. Sometimes the machines are not the same, so they need to learn the machines and so on. So that's the thing. Okay, so workplace related stress and all that were lessons that we need to look into. Okay, so beyond COVID, what are we supposed to do? The radiology department management should therefore seek to mitigate the impact of their workforce through consistent communication. Okay, communication is the important thing. So for the readiness for post-COVID service delivery, we have to develop and implement post-pandemic working protocols. We have to have continuous professional development activities, ongoing education. Maybe it has to be incorporated in the diploma or degree studies also, okay, about how to face a pandemic or a disaster or something like that, okay. So, and then there should be consistent communication, okay. Communication is very important to reassure the staff, okay. And there should be provision of clear infection prevention and control guidance. Most of the time we have a guideline, we just share and we expect our staff to read. Okay, but then not everything that you read that you understand. So it has to be, provided in such a way that staff can really master the infection prevention and control guidance. Okay, resource acquisition, PPE, imaging equipment with accessories and consumables need to be prepared also. Hybrid workforce, it means hybrid workforce is something that the department has to train their radiographers so that they can handle different imaging equipments, on a rotation basis, so that when a crisis arises, they can function in any of the modalities. That should be the prepared. That is hybrid workforce. That means they can work anywhere or with any machine. They are able to work in the department. Okay. Remote working is something new that actually Siemens have got a remote working virtual cockpit technology. Siemens Health News, Synco Virtual Cockpit, where we can have other specialized radiographers working from other hospitals to do to control remotely the scanner work from other places lah, and all that. This is something new which is not established in Malaysia yet. I think so. I'm not very sure about this. So, and then we have to strengthen institutional structures for management workplace related stress. Maybe we should have a supporting group to counsel, or we need to set or prepare our staff to go for counseling. Most of the time when we say counseling, staff think they are problematic. It's not problematic. It's actually to help them overcome certain stress level and so on. Okay, so basically that is my conclusion is the readiness. I think we are already this thing, and thank you, and these are my references. So it takes a team to deliver healthier futures, so it all depends on us what part will we play lah. Okay, thank you.
Okay, thank you, madam, for the clear slide. I think from your presentation, I can see that it is very exhausting during the pandemic, right? It is very exhausting. Is it
Yes,
very tough? But I think our radiographers are doing a very good
but
job
very
because they are very efficient and willing to learn. That's what that's what makes an experience, right?
yes.
Thank you, madam.
It
Thank
was very
you.
exhausting, but it all depends on the management, how they manage the
Yes,
staffs.
true,
Yeah.
true. Okay, now is Mr. Esnu's turn to present his slides.
Okay, I believe you all can see my slide, can hear my voice.
Yes, it's clear.
Okay, thank you everyone for your time today. Thank you, Madam Miss Moderator. To Madam Mary, happy Diwali. Yeah, I still remember that I've been working with you for, when I was a student last time until I left Malaysia and moved to Singapore. So I think I've met you a few times. So yeah, thank you for all your contribution to the Society of Radiographer in Malaysia. Okay,
Thank you.
so so hope you all see my screen. So I believe I would like to share this part of my journey before I move to my content. So uh, I started my career in 2004 after I finished my degree. I was the first what we call it batch of degree in diagnostic imaging and radiation therapy under the UKM. So I feel very old now. Okay, then yeah. So anyone can hear me because I feel suddenly quiet.
Yes, I can.
Okay, good. Okay. Then because I think in clinical my exposure working clinically as radiographer is very limited or very far compared to Madam Mary. But the first hospital that I've been working as a trainee was Damansara Specialist Hospital. So it's KPJ, is very close to me. So that's where I did my internship, and then I also did a few locum there after I graduate. But my journey has changed because I feel that I have another passion, which is more on the teaching and more on the marketing. So due to that, I joined vendors instead of staying in the hospital. So from there, I started my career as ultrasound application specialist for Siemens. Before that, their name is Siemens. Now they changed to Siemens Healthineers. I stayed there for 7 years. I picked up my career as ultrasound application specialist for 4 years. And then after that, due to exposure to the business and marketing world, I feel like, okay, I need to improve myself because I have not learned anything much in terms of marketing and business throughout my student years. So that's the reason why I pick up this what we call it, the role as a strategic marketing, and start to explore myself, learn from ground as a sales and business IT manager. And then in 2012, I further my study in MBA, Master in Business Administration, focusing on strategic management. Okay, and with that, I able to secure myself a quite good role with General Electric as a country sales manager. And just 1 year after that, I've been offered a job to move to Singapore to what we call it to lead the business of CT scan, nuclear medicine, and molecular imaging for Philips, based in Singapore for the Southeast Asia region. And last me for nearly 5 years before I moved to Fujifilm, and I did what I really like most, which is working on education, and also give what we call it guidance to the countries, to all the subsidiaries that we have under the Fujifilm. So in 2019, I established and become the founder for Fujifilm Asia Pacific Healthcare Learning Academy, which is our education initiative. We collaborate with universities like Mahidol in Thailand, National University in Malaysia. We have also SIT and others. More university that we are aiming to collaborate. We hope that KPJUC will also collaborate with us in the future. And this year, I still challenge myself if I can still study. So I because of my passion in studying, education, teaching, I further my study in PhD in University Putra Malaysia. So my research will be on the CT scan. So that's roughly about myself. Okay, then now I will move to the my sharing for today, advancement in radiography, supporting the radiographers during COVID-19 pandemics. Okay, so yeah, when we talk about digital radiography, so I'm not going to talk about the other modality, the CT, MR, or ultrasound. I will focus more on the digital radiography, as I believe majority of the participants are radiographer. And in your mind, you always feel that, oh, radiography, general X-ray is the most basic things. There's nothing much fun behind it. So everyone aim to go for big modality like CT and MR. But you are wrong. The development of digital radiography is very fast. And during this COVID-19, you can see that the demand of digital radiography or DR or general X-ray itself is tremendous. Okay, so like you can see on my slide, okay, there's a lot of factors that increasing the demand of the radiography. And first out of all is a pandemic. So, okay, so whenever a pandemic comes in, the modality that people will look for is the general X-ray or the digital radiography itself. Okay, then there's increased occurrence of other cases, other diseases and cancer, cost effectiveness, easy access. Now the system, the X-ray system that you are using, if you are moving into digital radiography, your dose reduction is very, very low. As you can see on our first speaker just now, with Mary sharing about the FDR Nano, which is our Fujifilm latest mobile machine, which is very compact. Okay, so this is where the volume of this system has been increased tremendously. The number of this system has been supplied across the globe is tremendously. So I believe it's already nearly 2,000 units within the 5 years of this system being introduced. Okay, so in COVID-19 during the pandemic, okay, the role of mobile X-ray become very important, and this is the main imaging tool to diagnose the COVID-19 because it's still less sensitive compared to CT, but it has the advantage of portability, availability. It has easily clean, okay, to clean, and then it's also being preferred imaging machine because it can avoid department workflow disruption. Like example, you can push this to your temporary site, like the quarantine center and so on easily, and you can shift this machine between hospital to hospital, between the location within the hospital itself. And then it help in aid in decision pathway. Okay, so you can help in discharge admission, and it's also aid in ED and inpatient setting. So it's compact, and they have what we call it AI integrated inside, where after you scan, you can see the result straight away without waiting for the radiologist to look into it. So this is the advantage of this compact latest mobile X-ray system. So this is huge installation that we have in the United Kingdom, in even in our region itself. We have nearly 200 units in 1 year of installation. So the huge demand of this system. And then when we look into the advancement of digital radiography, you look at the detector technology itself, the image processing, the X-ray system, and image finding. So I will elaborate a little bit on each one of these due to the time constraint that we have. So everyone know, okay, when I started my student year, I was doing the film exposure, going into the film processing room, the dark room, which I hate the most. And that's also the reason why I feel that, oh, okay, I need to change modality, and end up me doing the ultrasound that time. Okay, but this is one of the reasons. But you can see with the latest technology, the digital radiography technology, the what we call it, the step involved is getting less and lesser, and it's very rapid, and it's really helped in reducing the workload. And I believe if a lot of if currently during this pandemic people still use film, I can imagine that the burnout of the radiographer is huge. So radiographer will be tired of doing it because they need to run and to go into the dark room to process every film, to carry a lot of cassette and so on. Even you can see during the CR also, if you move around, you need to carry a lot of cassette. But with digital radiography, you just need to carry one cassette and you can do exposure continuously. And even the cassette has the storage capacity of data and so on. So these are the advantage that we have. And then another things that you can also see is the weight of the detector itself. So we want to reduce the burden for the radiographer. The vendor has continuously develop and create lighter and lighter what we call it detector to be carried. So this can avoid in terms of occupational hazard for the radiographer when you carry around this detector, and also can reduce, okay, in terms of what we call it break or what we call it broken of the detector itself, because detector is very sensitive, because inside there's what we call it glass of base TFT detector, which is if you drop it can be break, and even we have a good what we call it material casing. But what happened now is due to this huge workload, huge demand of digital radiography, and during pandemic, this is what we wanted to reduce the burden of the radiographer. We design as Fujifilm, we are leader in detector technology, so we redesign the detector. There's no more glass-based TFT detector. So this being replaced by thin film. So if you talk about Fujifilm, yes, film is still close to us, but this is a new way that we use the knowledge of film technology to redesign the detector. And this is how it works. So it become very light, half of the weight of the earlier detector. And then in terms of image processing, there's a dose reduction that we've been talking about. This is in terms of improvement in terms of the hardware design and the image processing quality. So if you look, this is how it looks like in 1983, and now this is the difference. So you can see the progress of digital radiography when CR has been introduced. This is because of the technology that the vendor has been designed. Okay, for today, you can see how the image quality has been tremendous improvement compared to the earlier. Okay, so this is how it looks like nowadays, okay, with the virtual grid technology, another what we call it advancement that we have. If you can imagine, if you need to carry the grid everywhere nowadays during the pandemic, you will be like really what we call it tired, exhausted, burnout, to keep on repeating, carrying, positioning, and all these things. So now we have this virtual grid. You don't need to carry the grid anymore. And this is based on the technology, how we can improve the image quality. by redesigning the grid using scatter knowledge, okay, based on the percentage of scatter knowledge that we know, we redesign, we create the algorithm that able to support it. And due to all this technology, you can see that the demand of the exposure for the chest, for the X-ray, become lesser and lesser. The exposure factor become lower and lower. And due to this, we're able to redesign the machine itself. So if you look at the machine before, it's huge, it's bulky, it's heavy, about 500 kilogram. And I believe all of you, when you try to push a machine, even it being motorized, you have a lot of difficulty. Like example, you cannot see something in front of you. And that's why you always need to have 2 person to move around with. Okay, so you need to have someone that probably in front of you just to look at if there's a child running in front of you, there's any object in front of you, because you can't see with this machine. So you need to have more what we call operator to run this machine. So this is very challenging, and this is because when we move from film to digital mobile X-ray, we need to embed all the processing unit and the monitor inside. Okay, and then as I can show you the emergency room, this is how it looks like, and the machine is very bulky. So there's a need of redesign, and that's why the one that we have shared earlier, the latest design of our mobile X-ray that we have. Besides, it's very compact. Okay, it has this antibacterial coating, and there is study about this with COVID-19. Okay, and then due to this new design, so there's a need of this to have less button and so on. So we have a clean flat surface, and then it's a waterproof. Okay, so this is the coating that you will what we call it found on this machine. You might not know, but there is a what we call it antibacterial coating on the machine and on the detector itself that reduce what we call it the contamination during the examination. So here you just need to use water to wipe it, and then the silver ion will be coated on the surface again. And what's next? So next, we make it more portable, because as I shared earlier, now the detector become more advanced. Okay, you don't need big exposure factor anymore. So what we can do now is the vendor like Fujifilm has designed more compact system. Okay, we're talking about last time 500 kilogram, move to the mobile system, which is 90 kilogram, and you can steer around easily, and you can still see structure in front of you. And next is we design a portable X-ray, which is only 3.5 kilogram. Okay, and it able to bring these X-ray services beyond the hospital setup itself, beyond the clinic itself. It goes into the community. So this is the objective, and this is really in line with the current situation is okay. What we call it, the burden of the radiologist to report is increased, and this is where AI able to assist them in getting more time, okay, to focus on more other important things, or to focus more on getting a better decision making for the patient. Okay, so we'll not talk much, but there's AI, the earlier version with machine learning, and then now you can start seeing more deep learning because of the technology advancement of the processing unit. Okay, so this is very interesting for those who are interested in doing research and so on. And this is how it works. Okay, this is example of how a deep learning method applied for CT scan. Okay, so now what you can do is, based on the algorithm that has been created, okay, what we call it, the artificial intelligence inside the CT processing unit, you can use just a very low dose, ultra low dose images or screen, this where you can use for screening. Then you can get the same high good image quality similar to the normal dose that they use. So this is one. And then in terms of the chest digital radiography, okay, so this is how it works. Okay, you can the algorithm has created based on the input from the cases. Okay, so the positive cases, the negative cases, and also those cases that refer to the CT. okay, result. So based on this, the algorithm can detect the abnormality on the image, and this make it available on this portable system where you can have the artificial intelligence integrated in the mobile system itself. So when you push around, like you can see on the image that I shared, this is how it looks like in Thailand and also in Vietnam. So when they expose, okay, the physician there can what we call it, talk to the radiographer and look at the finding, what is happening and how's the progress of the what we call it COVID-19. So this is an example of how COVID-19 artificial intelligence look like and how it being used. So last time we have PCR, so we need even now we need 1 or 2 days for the result, but with what we call it portable X-ray that integrated with AI, you can start doing all this triaging for the patient in less than 30 minutes, and then you can have what we call it the system to be used for monitoring of the progress. So this is in general how it looks like. Okay. So wrapping up. So AI and radiographers. So so first is in Thailand for the use of AI in FDR Nano, okay, the mobile system, and we have Vietnam is the first who use the portable small X-ray with AI reporting. So like this, that how it can be seen. So you can see that radiographer is no more within the hospital itself. It will go out to the community in the near future. You can travel, like example, this is under the TB program. So you can travel around and do this X-ray and so on. So that's all from me. Okay, so as a conclusion, okay, development of medical imaging is fast and dynamic. Okay, will benefit the radiologist and also for the radiographer. Okay, and for radiographer, for you, all of you, you need to continuously adapt to new technology. Technology is there. Okay, you can learn new skill, like example, data scientist, you can become an AI developer because you are the one who understand the foundation of digital radiography. So thank you. Hand over the session to the moderator.
Thank you, Mr. Esnu. Wow, I'm super amazed. It's like in the future there will be no room anymore. Radiographers will go anywhere.
I can see that, but it depends on the regulatory of every country. Okay,
I
so
see.
yeah, for some countries like Vietnam, because they have a lot of remote island, so they need to bring this portable system out to the community. So that's why they need the portable system.
Okay. And I am very agree with you that actually future radiographers will need to adapt with every situation and with every technology. They really need to master their skills. Okay. Thank you, Mr. Esnu, for the slide. Okay, with all the presentation done, we will have a little bit of discussion session, and we will have two questions, one for Mr. Esnu and one for Madam Mary. So the first question will go to Madam Mary. Okay, so Madam Mary, you have a lot of experience, right? So I want to know what is your tips and suggestions for students as how to prepare ourselves to work in a tough environment in the future.
Thank you, moderator, for the very good question related to the theme today. Okay, how to prepare yourselves as radiography students to work in a tough environment in future? If I'm not mistaken, the question just now, because it was not clear just now. Okay, so I think Mr. Isnu has touched on that. Even I have touched on that. That all the radiography students should master their skill. Master their skill in terms of the uh, whether you are a degree or diploma student. You have to bear in mind your bread and butter is general radiography. Okay, so I think we shouldn't always think, oh, general radiography is so simple, so we just, oh, degree holders, we don't have to do that, we straight away go to CT, MRI, and so on. So that's not the real situation. Always remember that general radiography is your bread and butter. You have to master it. You have to master the skill. You have to master the positioning and techniques of general radiography. And also you need to update yourself with a lot of knowledge by reading journals and articles on all these pandemic or disaster that has got relationship with our radiography. Yeah, so that's the thing. Okay, first of all, when you enter into a working environment, you have to leave behind your mindset that you're no more a student. Okay, you're no more a student. You must be fully functional, and you should be. Your skills must be up to date, so that when you go in, if for example situation like pandemic, we didn't have time to let the new recruited radiographers to go for tagging very long. We couldn't, because we wanted the workforce, so we had to straight away put them into rostering, and then they had to function straight away. So in that case, you should be really mastering your skills, and you should be able to perform without guidance, in fact. Okay, so my advice is, during your practical sections, please concentrate. Before that, make sure your theory is strong. Okay, and then learn about the policies and protocols in the radiology department, especially radiology department. I'm talking about radiology department. So even if nuclear medicine or radiotherapy also, I think it's the same. You have to know a bit about the administration, the policies and the guidelines in those departments. So when you go for your practical, try to be extra, what you call, take your extra steps to learn more about all these things, so that you will be equipped well. So mentally and physically and spiritually and also emotionally, you have to be prepared to face these challenges. That is the important thing. Yeah, so because physically you have to be strong, you have to be, you cannot be very, as you know, as you saw my slide, it's very hectic and it's very hard work, a lot of hard work in there. You have to, then most of the x-rays were mobile, where we need to touch the patient, we have to carry the patient, we have to, a lot of things we need to use our energy to the maximum. So our physical health and mental health and emotionally also, we have to be stable. So if emotionally, if you're not stable, don't hesitate to look for help. Go for counseling. Even student time also, you can go for counseling. Counselors actually help a lot. Okay, don't be down, don't be afraid looking at the environment, because we had situations where radiographers were already starting to apply for early retirement, and they were already thinking of changing jobs. We had situations like that. In fact, luckily KKM did not allow, or JPA did not allow them to go on retirement, optional retirement, because we were short of staff. So those kind of situations, when we are in the medical line or the healthcare line, we should be ready to face any challenge. So that mindset should be there. If your mindset or your determination, enthusiasm to take up challenges is there, it will help you through in any type of situation at any time. So you just get on with it lah. So that's my advice. Hope it helps.
It's just we need to be ready for any circumstances, right? Okay,
Yes.
okay. So now with the last question, but absolutely not the least, because after this we have an open question session, and now the last question will go to Mr. Esnu, obviously. So, Mr. Esnu, what other skills are needed other than professional clinical skills to enhance student chance to go beyond the clinical field and be versatile in their future?
Okay, this is very what we call it challenging. Not really. I think all the new generation are different than my generation or even the earlier generation. Okay, your digital savvy plays important role. You need to keep up with that. Okay, what I'm missing now is as the clinical marketing manager for the whole region, Asia Pacific, we are lacking of what we call it content that created by radiographer, and this is where you can promote our profession. As you can see, nurses are keep on doing TikTok. No, it sounds bad, but it's where people are looking at and know what you are doing. Okay, so example, I really happy with the Malaysia radiographer when COVID-19 was started, and then it was in the quarantine center. So they show how they handle the X-ray for the COVID-19, and this video that they show on the, I believe in Facebook or somewhere, I've been using it to show the world that how Malaysia is ready to handle it, and then with the advance of technology that we have. So this is the thing. So what I want to say here is, okay, don't limit yourself on your clinical only. Try to catch up with the advanced demand, the current demand, like the digital marketing, what we call it, knowledge, understand that, and then be confident. Okay, skills that you need, like you as a moderator, I feel that, okay, you have your confidence level compared to the others that might probably hiding behind the screen, that are scared. So don't be afraid of that. I was like you before, so keep on being the in the front line of my student years, so when you try to explore the new world, it's much more easier for you. And again, like what Madam Mary said, foundation is important. The knowledge what you learn in university will be using in your work life. Okay, like for me, if I didn't get a good foundation learning from my lecturers or learning from even from Madam Mary when during clinical years, I cannot survive here, because you need to have that foundation. Important technology is keep on advancing, but foundation is still there. So without good foundation, you cannot adapt. You cannot adapt with the new technology. And for me, coming from X-ray background, go to ultrasound, go to molecular imaging, radiation therapy, radio surgery, now back to chest X-ray again, mammography. So this is where foundation plays. So whatever you learn, you don't throw it away. That is your foundation and make you different than others. So the skill that you need to have is confident, get into digital marketing knowledge, keep creating what we call it, creative ideas, on TikTok, on Facebook, on Instagram, about the profession, so that everyone knows that we are the one who also the frontliner during this COVID-19. Okay, so I think that's on my side. Yeah.
So, I think as a student for future radiographer, I think students nowadays need to have that mindset that the sky is the limit. And as long as if God wills, everything will be achieved. Okay, okay. Thank you, Mr. Esnu and Madam Mary, for this fruitful talk. Like, I am really lucky to be here with both of you. Like, I am very intimidated by both of you, but in a good way. But in a good way, because both of you are very charismatic, and I think this is like my first time having this kind of talk, and I'm very happy, very content today. Thank you very much. Okay, now we will have an open question session, and actually we have some from Facebook and YouTube. Okay, so the first question is from Nurul Fazlin from YouTube. It is for Madam Mary. So the question is, hi. So in tough environments of health workers, what would happen to a worker with mental health problem, such as depression in treatment, and at the same time they have to cope with their depression?
Okay, so a worker with mental health problem, but if she or he is under treatment, I, of course they have a letter from the psychiatrist. So usually we excuse those who are at high risk group lah. High risk group meaning those who have diabetes, hypertension, and also mental health with proper document from psychiatrists. We will try our best not to involve them in the team lah, in the team. So they might be dealing with the registration of patients or such as that other works which is not so pressure for them lah, which is quite light for them. So other than that, mental depression, they are already under treatment, means they are already going through counseling and so on. So we don't have to refer them again for counseling in this and that. Okay. So this is what we usually do in Hospital Tunku Aziza. Also, we have one or two with depression problem. We excuse them. So they were involved in other things.
So they are placed to a less stress environment,
Stress.
right? Yes.
Yes.
Okay, okay. So and now the second question for Mr. Esnu. It is from Facebook from a username named Scully. Okay. So the question is, can this COVID-19 pandemic enable technologies to improve technology in the use of medical imaging application more effectively, and how?
Okay, thank you. Okay, the question a bit twisted, but can everyone hear me? Sorry, it was cut off just
Uh,
now.
it's like your line is
Hello.
lagging. Your line is lagging.
Okay, now can hear me?
Okay. Now can.
Yes, okay, sorry
Okay.
about that. So what happened now here is we as a vendors that design the system, we have a lot of what we call it brain we put inside it, but it depends on the technologies. So during this COVID-19, we have seen that the technologies has become more what we call it wiser and maximize the usage of the technology itself. So sometimes when we are comfort doing the repetitive job, we never challenge ourselves. We stick to the same approach and keep on doing the same thing. But when during the COVID-19, the pandemic make us less uncomfortable, we challenge ourselves to stand up. And then I believe this is where you can improve the use of the system effectively. So I've seen it in X-ray and also in CT as well.
Okay, okay. But I guess every time there's changes in our era, there will be changes in technology too, right? I mean,
Yes.
the world is keeping up with technology every time. It will never go back. Okay, okay. So with the open session discussion, that's the mark of our ending today, sadly. Thank you for your questions from our audience. We really appreciate your questions. And thank you for the speakers for joining us today. I am very honored to have a talk with you guys. Okay, it seems like Mr. Esnu's line have problem. Okay, it's okay. While we're waiting for Mr. Esnu, I want to remind our audience that Starting from tomorrow, we have radiography and video, radiography, photography and video competition held by KPJUC, RADSA Association. And don't worry, it have prizes. And also after this, we have quizzes that also have prizes. So worry not, okay? Just participate. Very encourage you guys to. So so I want to say some gratitude to Mr. Esnu and Madam Mary. They actually had a rehearsal with us, and at that night they are very helpful. We clear everything out, and they are very professional. Like they are someone that we should take example from. So okay, Mr. Esnu is gone again. It's okay. So I to end this talk, I want to apology for my wrongdoings if ada tersalah kata ke ataupun tidak selesa, awkward or anything. Sesungguhnya semua yang baik datang daripada Allah dan yang tidak sempurna adalah daripada saya. I want to remind our audience today to mask up and always sanitize ourselves and jaga kita punya social distancing, so kita punya kes dekat Malaysia ni tak mungkin tidak akan meningkat rapidly and under control. So we need to help our government, alright? So that's all. Thank you and Assalamualaikum. See you again. Do not forget for the
Thank you.
quizzes. Stay tuned.